bills to hear today, 5 of which are eligible for a vote, and all the remaining measures are suspense items. Just a note, SB 820 by Senator Hertzberg and SB 999 by Senator Pavley are still listed in the daily file, but those items will be rescheduled for our hearing next week at the author's request. As usual, I'd like to remind the audience and members that the testimony really should be limited to the fiscal aspects of the bill. Please refrain from lengthy policy discussions. Those already took place in your policy hearings. Sergeants, if you could please call the absent committee members, and the following authors are presenting bills so we can get started. Members that enjoy a due pass or due pass as amended are Senator Nguyen, Senator Hernandez, Senator Leyva, and also Senator Bell will be presenting a Transportation and Housing Committee bill. So we have Senator Nguyen here. Oh, we do have a quorum. Let's establish our quorum before we begin. Secretary, please call the roll.
Laura?
Here.
Laura, here. Bates? Here. Bates, here. Bell? Hill? Here. Hill, here. McGuire? Here. McGuire, here. Mendoza? Nielsen?
Perfect. Senator Nguyen, you have 4 items. Why don't we start with your due pass first, which is your SB 1012 members. This is SB 1012. Senator Nguyen, the floor is yours.
Thank you, Mr. Chair and Vice Chair Bates and members. Today, I'm pleased to present SB 1012, which would simply require that all American or California flags purchased by state or local governments with taxpayers' dollars come from American manufacturers. The California Department of General Services currently purchases national flags from the Fabric Products Enterprise at the Central California Women's Facility in Chochilla. However, there is no requirement to purchase U.S. or California flags from this facility or from any other American manufacturer. Local governments purchase flags from a variety of sources. The committee analysis states that the fiscal cost of this bill should be minimum. This bill has received support from the Made in the USA Foundation and many of the veterans organizations in California. I respectfully ask for an aye vote.
Thank you. Witnesses in support? Witnesses in opposition? Finance?
Jacqueline Wong Hernandez with the Department of Finance. We concur with the committee analysis that any fiscal impact would be very minimal.
Thank you. Comments or questions from committee? Seeing none, is there a motion on the measure? Senator Hill moves the bill. Secretary, please call the roll.
The motion is due pass to the Senate floor. Laura?
Aye.
Laura, aye. Bates? Aye. Bates, aye. Bell? Hill? Aye. Hill, aye. McGuire? Aye. McGuire, aye. Mendoza? Aye. Mendoza, aye. Nielsen?
5-0 currently. We'll hold that bill to allow our absent members to add on. Let's begin now with your suspense items with SB 893.
Thank you, Mr. Chairman and members. Senate Bill 893 will provide education assistance to the dependents of those killed during the the San Bernardino terrorist attacks. The bill will provide a tuition and fee waiver for surviving spouses and children to attend the UC, CSU, and community college system. On December 2nd, 2015, employees at the Inland Regional Center in San Bernardino experienced the most violent terrorist attack in the United States since September 11th. In total, 14 people were killed and many more were injured during the attack. These 14 people had stories like Tin Nguyen, a constituent in my district who took the 2-hour daily commute from Santa Ana to her job in San Bernardino because she preferred to live close to her family. She was described by her family as the super glue that held them together. Previous legislation enacted by this legislative body after the terror attacks on 9/11 provided a similar avenue for which the family members of victims can attend higher education. One of the victims, Juan Espinoza, was quoted as saying, having an education is first priority and an education is a treasure that nobody can take away. Colleagues, I understand this is a candidate for suspense, but I ask you to help ensure that the dependents of the victims of the San Bernardino terrorist attack are ensured access to quality education and to move the bill out of the committee when appropriate. I also wanted to state in the analysis, Mr. Chairman, I can take amendments to removing UC Hastings College of Law because the intention of the bill is for undergraduate program. And second is that there is a comment here that says that potentially non-residents of California can also take this. I can also make sure, my goal was to have these individuals who lives in California, not that if they move out of California and then gets the tuition waiver. And so I would be more than happy to amend those when it's appropriate as well.
Thank you. Witnesses in support? Witnesses in opposition? Finance?
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, Senator Nguyen, would you like to close?
I ask for your support when it's appropriate.
Thank you. Without objection, we move this item to the suspense file. Moving on to file SB 898. Senator Nguyen.
Thank you, Mr. Chairman and members. SB 898, which provides a tax exemption for the sale of animal blood by a licensed animal blood bank. The state of California only has 2 animal blood bank establishments that hold licenses to sell animal blood for the treatment of animals. Under current law, the state recognizes human blood transfer as being exempt from the sales tax. Until recently, the state's tax agencies treated animal blood banks the same as human blood banks. Attorneys at the BOE have now decided that human and animal blood banks should be treated differently, and the transfer of animal blood should be taxed. Due to a recent BOE audit, Hemopet, a nonprofit animal blood bank in Garden Grove, was retroactively found to owe $105,000 in unpaid sales tax over a 3-year period. Hemopet has since 1986 provide much of the blood supply for animal surgeries in Southern California. It accounts for about 80% of animal blood bank in Orange County, and across the state about 40%. The BOE decision could put this much-needed blood bank out of business. Many veterinarians across California and throughout the United States have contacted me in support of SB 898 about the need to protect services provided by the California Animal Blood Banks. I ask that you, I also understand this is going to be it's a candidate for suspense as well, and I hope that you would consider moving it out of suspense when it's appropriate.
Thank you. Thank you. Witnesses in support? Come on down.
Mr. Chair and members, Mike Dillon, representing the California Veterinary Medical Association, in support.
Thank you. Witnesses in opposition? Finance?
The Department of Finance is opposed to this bill because it results in revenue losses and extends a tax benefit to a very specific industry. As has been noted, there are only 2 animal blood banks in California, and the Board of Equalization estimates annual state and local revenue losses of $158,000. If it's determined that additional outstanding tax liabilities are found for those 2 entities, then the cost would be higher, but that's what they found right now.
Okay. Comments or questions from committee? Seeing and hearing none, Senator Nguyen, would you like to close?
I respectfully ask for your support when it's appropriate.
Thank you. Without objection, we move this item to the suspense file. Moving on to your last item today is SB 1088.
Thank you, Mr. Chairman and members. I present to you a bill involving a case that was unsettling to the residents of Orange County and devastating to the parents of a young woman named Erica Alonzo. On Valentine's Day 2015, Erica went missing. On April 27th, Erica's body was found more than 70 days after being reported missing. Although the investigation determined that Erica's death was accidental, the location where her body was found indicates that someone attempted to conceal her death. During Erica's disappearance, her father visited my office to ask for our help posting missing person signs. He returned a few months later to share his grief and his concerns with current California law, under which the person who moved Erica's body can only be charged with the sentencing equivalent of a petty theft. He wanted to further discourage individuals from concealing bodies after an accidental death and also to minimize the suffering of families like his. Under current law, individuals who conceal bodies after an accidental death can only be charged with a misdemeanor. SB 1088 would increase the penalty from a misdemeanor to a felony if the judge deems the penalty increases is necessary. Colleagues, I ask, this bill was unanimously passed and supported by the Senate Public Safety Committee. I also understand this is a candidate for a suspense, but I ask you to help ensure that justice is provided by moving the bill out of the committee when it is appropriate.
Thank you. Witnesses in support? Witnesses in opposition? Finance?
No file.
No file. Comments or questions from committee? Senator Bates?
Just to note, our analysis indicates that the cost would be less than $50,000 a year. Just want to make a note of that because they don't have a file at the moment, but I think that's an important focus for the bill going forward since it's had unanimous support so far.
Duly noted, Madam Vice Chair. Without objection, we'll move this item to the suspense file. Thank you, Senator Nguyen. We have Senator Monning. Senator Monning has two items. We'll begin with SB 968. Senator Monning.
Good morning, Mr. Chair and members. Senate Bill 968 requires an economic assessment of the adverse and beneficial impacts that could occur in the event that the Diablo nuclear power plant shuts down. The economic assessment is an appropriate use of ratepayer funds because all ratepayers have benefited from the energy generated from Diablo Canyon, and there are past examples of ratepayer-funded studies only benefiting a single region. Even if there is a disagreement on this point, the actual impact to ratepayers will be de minimis. San Luis Obispo's economy is heavily reliant on Diablo Canyon, which is why an independent, accurate assessment to help identify ways to mitigate the impacts is indeed prudent. I, along with Assemblymember Asajian, have a duty to protect the region that we represent from economic harm, and SB 968 is a means for the San Luis Obispo community to plan and discuss in the event of the plant's closure. I recognize this is a candidate for suspense and would urge an aye vote at the appropriate time, and we have a couple of witnesses in support. Thank you.
Thank you. Witnesses in support.
Good morning, Chair and members. Derek Lennox on behalf of the San Luis Coastal Unified School District. This is the school district that encompasses the power plant and surrounding region, so it's really impacted by the local economy that's brought to the area by PG&E and the power plants. The nexus, we think, with state funding here is the fact that when the local economy becomes depressed because of a sudden instance like the closure of a power plant, we would see an augmentation in state funding required under the local control funding formula and our unique funding system here in California. So we think that at some point there could be a big augmentation devoted to this very school district and surrounding area, given its $80 million annual operating budget and the fact that it might fall out of basic aid status. And so we urge you to support the bill. Thank you. Thank you.
Good morning, Mr. Chair and members. Karen Lang on behalf of the San Luis Obispo County Board of Supervisors. The county collects almost $26 million in property taxes from the existence of the plant. Obviously, that goes to all the taxing entities, including the school district. We have concerns about any sudden or overtime closure of the plant, and so a third-party analysis would be really helpful, we think, and we urge your aye vote when the time comes. Thank you.
Thank you. Additional witnesses in support. Go ahead.
My children attended the San Luis Obispo County School District. We are in a location where the Diablo Canyon nuclear power plant is a risk. It's a risk to all of us. We have lived with that risk for as long as it's been open. Power has been generated for the people of the state of California, all throughout the state of California, not just San Luis Obispo. I think it would be appropriate to recognize the fact that for the risk that the residents of San Luis Obispo and the school district and the county took, it would be helpful if we could have this study done. We think it's appropriate, and we also think it's fair because the entire state of California benefited from the power generated in San Luis Obispo County. Thank you.
Thank you. Witnesses in opposition. You're in opposition? Okay, please come forward.
Good morning, Chair.
Good morning.
Commission. I am Molly Johnson. I am here today to present the opposition of more than 30 environmental health and other organizations, including Public Citizen, Greenpeace, LA and San Francisco Bay chapters of Physicians for Social Responsibility, San Luis Obispo Mothers for Peace, and the Northern Man of the Chumash Council. We remain troubled by the bill's one-sided nature, although it is getting better, and we are working with to continue that. It still focuses on adverse economic more than a balanced, and we would like to see it more balanced. We do see that there has been an amount put to the bill, which we did not see until just a little bit ago. So even though these matters are now touched upon by the staff report, we feel that this is still a wasteful expense unless it is a balanced bill. Thank you.
Thank you.
And I would like these to be.
Absolutely. We'll have sergeants pass those out to the members. Thank you. Next witness.
Good morning.
Good morning.
I am Tabesh Zaidi. I'm appearing on behalf of the San Francisco Bay and Los Angeles chapters of Physicians for Social Responsibility, which has long worked to address nuclear risks. And Senator Moaning once served as executive director of PSR's parent International Physicians Organization. And PSR's opposition to his bill on Diablo Canyon is thus painful and has been entered into lightly. PSR reluctantly has concluded that this bill would be at variance with the fundamental principle, do no harm, by calling on PG&E to submit an analysis of the supposedly adverse economic impacts of closing the plant at the end of its design life, with no discussion of impacts of a Fukushima-type disaster were the plan to keep running. The study would amount to a piece of advocacy for continued operation of this dangerous facility. Each Diablo unit contains 1,000 times the long-lived radioactivity of the Hiroshima bomb. Each year, Diablo produces enough plutonium for hundreds of nuclear weapons, as well as waste toxic for 500,000 years. The plant was built based on the assumption there were no active earthquake faults within 30 kilometers. Now we know there are 4. It is a catastrophe waiting to happen. The public should not be forced to pay as taxpayers or ratepayers for a wasteful, unbalanced, and unnecessary report that may have the effect of implicitly pushing for the continuation of these risks. Thank you.
Thank you. I appreciate your testimony. Additional witnesses in opposition. Finance.
Sorry, Chair, no file.
No file. Comments or questions from committee? Seeing none, Senator Moaning, would you like to close?
Thank you, Mr. Chair. Members, just one slight correction on the opposition testimony. We do remain open to working with them. This would not be a study conducted by PG&E. It would be supported by an independent study. With that, again, I would request at the appropriate time an aye vote. Thank you.
Thank you. Without objection, we move this item to the suspense file. Next item is SB 1100.
Yes, thank you, Mr. Chair, members. I understand this is also a candidate for suspense. The Worker Occupational Safety and Health Training and Educational Program, known as WashTEP, was created in 2002 as part of a workers' compensation reform effort. It was aimed at reducing occupational injuries and illnesses and workers' compensation costs in California workplaces. Its purpose is to promote injury and illness prevention through training and dissemination of materials by a statewide network of training providers. Senate Bill 1100 will expand WashTEP to increase protections for workers and workplaces by expanding the training network to increase the focus on particularly vulnerable workers and work groups. In addition, this legislation will develop a California-focused occupational research program that identifies and promotes effective ways to prevent workplace hazards, which will decrease work-related injuries, illnesses, and deaths. Finally, SB 1100 will expand WashTEP to increase coordination and communication between community-based health care programs and occupational health experts in the currently existing University of California Centers for Occupational and Environmental Health. This will improve outcomes for injured workers and employers by preventing similar injuries from reoccurring or happening in the future. I'm working with stakeholders to ensure that costs to the departments affected by this law are indeed minimal. Would request an aye vote at the appropriate time, and with the chair's permission, the opportunity to present witness in support.
Thank you. Witnesses in support.
Thank you, Mr. Chair. Members, Mitch Seaman with the California Labor Federation in support of this bill. We would just point out that the average cost of a workers' comp claim in California is now approaching $90,000. And so efforts like this that make even modest investments in injury prevention will tend to produce savings that dramatically overwhelm whatever the cost of the prevention efforts are, both for private sector employers, but also for the state as well. So at the appropriate time, we'd urge your support.
Thank you. Witnesses in opposition. Finance.
The Department of Finance is opposed to this bill because we believe it will result in potentially significant costs for the Department of Industrial Relations, the Department of Public Health, and UC.
Thank you. Comments or questions from committee? Seeing and hearing none, Senator Monin, would you like to close?
Yes, again, just briefly, we are working with the departments affected. We are using existing programs, not creating a new program, and think in the long term it will save employers, workers, and the state money. And would ask again for an aye vote at the appropriate time. Thank you, Mr. Chair and members.
Thank you. Members, next we have Senator Hernandez. Oh, wait, did we move it? Senator Hernandez, please come forward. Senator Hernandez, you have 4 items. My understanding is you're waiving presentation on 3?
We are waiving presentation on 3, and we're going to be presenting SB 1076, Mr. Chair.
Thank you. The committee really appreciates you waiving your measures, Mr. Hernandez.
Thank you, Mr. Chair.
Thank you. So you have a due pass recommendation on SB 1076.
Thank you, Mr. Chair. Member, this bill is intended to address problems associated with the growing trend of patients being treated under observation status for extended periods of time. This requires hospitals to provide notice to patients who have been placed on observation status so they are receiving services as an outpatient, and that this may affect insurance reimbursements. Additionally, the bill ensures observation services continue to meet existing staffing requirements and requires hospitals to report observation services to the Office of Statewide Health Planning and Development so that we have better data on the growing phenomena. When it was in Health Committee, we were able to reach agreement with the California Hospital Association on amendments and remove their opposition, and we are continuing to work with the tenant hospitals to see if we can address their remaining concerns. And with that, members, I have individuals like to speak here in support, and I ask for your aye vote.
Thank you. Witnesses in support.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association, proud sponsors of Senator Hernandez bill, SB 1076. As the senator had stated, members, more and more hospitals are placing patients who cannot be safely discharged to their homes in observation status as an alternative to hospital admission. In these settings, patients are sometimes placed for prolonged periods of time. Many patients are not aware that they are in observation, leaving them to believe that they are admitted as inpatients, especially when they are in inpatient areas. This is especially concerning to patients who may need to be discharged to a long-term care facility, as Medicare requires patients to be admitted as inpatients for 3 days. Time spent in observation does not count, as these are considered outpatient services. This bill allows us to improve on the already existing federal requirement of notice. If we can get this information to patients sooner, they are not surprised when the case manager at the long-term care facility tells them Medicare won't pay, and they have to pay out of pocket. So this allows patients to be prepared for that scenario. There are other elements of the bill that the senator had stated, such as staffing, data collection, and other elements that are important to know and give the legislature more information on the utilization of observation. So with that, members, we would appreciate an aye vote. Thank you.
Thank you. Additional witnesses in support.
Mr. Chair, member Sarah Fox, the California Labor Federation. We're also here in support of this bill for its patient protections. Thank you.
Thank you. Additional witnesses in support. Witnesses in opposition, please come forward.
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Emergency Physicians, and I just want to clarify that we have removed our opposition based on the amendments taken in Senate Health, and just wanted to thank the author, staff, and sponsors for their work.
Thank you.
Mr. Chair and members, Michael Hawkins on behalf of Tenet Hospitals. We've been working with the author of the bill and the staff. We have 2 concerns. Tenet treats its observation patients as acute care patients, and so we believe that the notice is too broad. We would like to be able to do a different notice, and we already report our observation statistics to OSHPD. So if we can resolve those 2 issues, we think this is a good bill. Thank you.
Thank you. Finance.
No file.
No file. Comments or questions from committee? Go ahead, Senator Bates.
I am concerned that those who are in observation units then are held there, then moved to another facility or actually discharged. They have to pay for those. Is that correct? And that amounts to thousands of dollars for some individuals. That's a real issue. That's the current status.
Right.
And how is this helping that, other than letting people know? Wouldn't they be in the situation of kind of, admit me? Don't observe me, admit me.
I mean, it's the issue of notice. I mean, anytime we can place information in the hands of consumers or patients sooner, they can make a call, they can talk to their family members, they can, get that money together to prepare for the unfortunate situation that they show up to these facilities and they're surprised. They don't have the time, to get their finances together. So in that sense, we think it's an important piece of information for patients to know, and it's a real issue. Unfortunately, Cara wasn't here to come and support the bill, but it was a cornerstone of their lobby day last year and years prior. It's a real issue out there. So this will start to crack at that issue.
But adding people to the observation unit, if I understand this correctly, would actually increase that cost if there's more individuals who have to be in the observation unit. Is that correct?
Well, if we could have a different bill, we would. We wouldn't even want that practice to happen. But, I mean, we're trying to deal, with the situation that exists today. And observation is it's a real status. So to the extent that we can get patients observed and moved quickly, that's kind of the confines that we're working with right now. So.
Thank you.
Senator Hernandez, would you like to?
Yeah, I'd like to close to Senator Bates' question. It's not adding any more individuals to the system. It's just disclosing the information. And with that, members, I respectfully ask for an aye vote.
Thank you. Members, this is, can I get a motion on this, on Senator Hernandez's bill? There's a motion by Senator Hill. Secretary, this is due pass. Secretary, please call the roll.
Laura?
Aye.
Laura, aye. Bates? No. Bates, no. Bell? Hill?
Aye.
Hill, aye. McGuire? Aye. McGuire, aye. Mendoza? Aye. Mendoza, aye. Nielsen?
We are currently at 4-1. Senator Hernandez, we'll leave the roll open to allow absent members to add on.
Thank you, Mr. Chair.
Thank you, Senator Hernandez. See Senator Jackson. Please come forward. Senator Jackson, you have one item. It's an item, suspense item, SB 1166. Floor is yours.
Thank you very much, Mr. Chair and members. I thought I'd come in today and play the gender card in talking about new parent leave. California falls behind the District of Columbia, Maine, Massachusetts, Minnesota, Oregon, Washington, and now New York in providing job-protected parental leave for small business employees. Under current California law, only those who work for an employer of 50 or more are eligible for job-protected parental leave here in California. That leaves more than 40% of California's workers without any job-protected family leave, and many new parents struggling with an impossible choice between the well-being of their new child and their family's financial responsibility. Narrowly focused on new parents, SB 1166 would extend job-protected parental leave. By job-protected, we mean that their job will be back available to them when they come back from taking 12 weeks, which is 3 months, to care for a newborn. This will provide leave for employees who work for an employer of 10 people or more. So the area we're talking now is from 10 to 50 employees, giving them the assurance that that job will be available to them when they come back. Lowering the employer threshold to 10 extends job-protected parental leave to an additional 26.3% of the workforce and an additional 12.5% of employers. While the Department of Fair Employment and Housing projects a relatively minimal cost for enforcing these new job protections, the cost of not allowing parents to care for newborns in these first few critical weeks, and the research now demonstrates unequivocally the critical importance of that 12 weeks, not only for the well-being of the child, but for the bonding of the parents. It is unequivocal now that these are a critical time in a child's early development. It is also to factor in that the benefits to families and society, as these are youngsters who are going to develop with much greater sense of self-esteem, stability in their lives. We'll see parents more and more involved when they have that initial period of time to be with and bond with their children. Again, it's the American Academy of Pediatrics, by the way, which is the one that did this study and recommends that healthy full-term infants should not be enrolled in childcare until they are at least 12 weeks old due to rapid developmental changes and the risk of quickly developing severe undetected illnesses. They are critical times. We ask that you consider this. I know it is an Appropriations candidate, but as we look to benefiting society going forward, as we look to the fact that the science today has clearly and unequivocally been able to demonstrate how important these 12 weeks are, actually how important the 0 to 3 years are, but we have just simply narrowed this bill to focus on the importance for both parents. This is new parent leave for 12 weeks. It doesn't cost the employer. It is employee paid if they are able to take that additional paid time. This just assures that at the end of 12 weeks, they will be able to go back to their job. This is done throughout the world. It's also done in other states. I frankly see it's inexplicable to me that this is something that we in California, who pride ourselves on being first, who pride ourselves on recognizing the importance of families, are not doing at this point. It's my hope that at the appropriate time you will pass this measure out of Appropriations and that we can get this on the books in California. And with that, Mariko Yoshihara with the California Employment Lawyers Association is here to testify on behalf of the bill.
Thank you. Witnesses in support.
Thank you, Mr. Chair and members. Mariko Yoshihara with the California Employment Lawyers Association, proud to co-sponsor this bill with the Equal Rights Advocates and Legal Aid Society Employment Law Center. This bill is simply about making sure that parents who have just had a new baby can keep their job at a time when they need it the most. Obviously, that kind of job security can have a huge impact on the state. Right now, if parents lose their job, they may lose their health care coverage. The loss in wages can also force them to have to rely on the state social safety net. So for these reasons, we think it's really important that these workers have that job security, can keep their jobs, and we strongly urge your support.
Thank you. Additional witnesses in support.
Thank you, Mr. Chair. Members, Mitch Seaman with the California Labor Federation, also in support. We see this as a very minor expenditure that will do a lot to expand this basic fundamental right to a lot of workers across California, and we urge your support at the appropriate time.
Thank you. Finance.
No file.
No file. I have a question, Senator Jackson. Does this include also adoptions?
Yes, it does. Okay. It does. Newborn adoptions. Again, the goal is to give parents and children a chance to do that initial bonding, which we know is so critical to their well-being.
Thank you. Any additional comments or questions from committee? Perfect. Thank you, Senator Jackson. Without objection,
Thank you. Appreciate your time.
Move this item to the suspense file. Senator Leyva.